You stay?
I'm called Mrs. Muzera Daffin. I'm a businesswoman.
Okay.
I stay in Mutungo.
Okay. Are you a mother?
Yes.
Or you're a mother to be? Or both?
I'm a mother of one, expecting to get another one.
Very good. Congratulations upon that. Welcome to the show, Daffin. Today we're looking at UTI. Before we go into that, what has been your experience as a mother? Anything bad? Or your journey to motherhood is all away? It's merrymaking.
No.
Yes,
it cannot
please.
just be merrymaking.
Okay.
Like still you have to find so many challenges as you are becoming a mother.
Okay.
You can get those morning sickness, nausea, headache, vomiting. Besides that, also like with time, as time goes by, because in the different stages of the pregnancy, from the first trimester up to the third trimester, there are so many challenges that we go through as mothers.
Yes.
But then it depends on how you have to handle them.
Okay.
Like maybe from my firstborn, it was different to this
From
other
the
one,
second
to
one,
the
yes.
second one, because like the way they say, like different children come with different
experiences.
Yes.
Okay.
On the first one, maybe I experienced too much of the UTI part of it, and maybe on the second one, maybe I got a lesson.
You learned a lesson.
from the first one, so I didn't find so many challenges.
Thank you so much for sharing. That's your brief experience in as far as giving birth is concerned. Today we're talking about UTI. Have you ever got one?
Yes, I've ever got one, more especially with my first child.
How was it?
It was kind of itchy. Then you still get that milky part of it. So now you could go for medication. So they tell you, do you know what? You go, you get this medicine, it works for some time. Then
it keeps coming back.
It keeps coming back. Then you go for a second one, it keeps coming back. Then they tell you, do you know what? Yes, you are going to face this challenge throughout the period of motherhood until you give birth.
Were you working by then?
Yes, I was.
Sharing toilets, latrines?
Yes, I was.
At home and at work?
At home and at work, yes, but at home still we aren't very many. Maybe the challenge could have come mostly from what? From work.
Okay.
That's where the challenges could have come from. Okay. But now here you had to you had to find means of how you can at least reduce on the effects of getting the UTI, since you needed this baby so much, you know, and being that you're a first-time mother, you're already scared,
surely,
thinking, oh God, what is this? What am I going through? Is it really going to be like that? By the way, I was really scared, thinking all children will come with UTI.
The same infection.
Yes.
What exactly were you experiencing, apart from the itching and the milk discharge? Any pain?
No, by the way, I didn't get a lot of pain throughout. It was just only itchy. And when you could go for medication, it could take you like for a month or two. When you're at least getting better, then like that, you again resume. So you have to go to the doctor again, talk to the doctor. Doctor, now I'm facing this and this and this and this. They give you, maybe now they have to shift you if they had been giving you like medicines, so they have to give you now injections just to protect the baby the baby that is inside the womb. Okay.
How did you, for example, now manage it permanently? Are you still getting it, or you're now much better?
Now I'm better because
when did you last get it?
I think with this baby I've just got it like once. And it was, I think, within just like 2 to 3 weeks when I noticed it. Okay. Because I'd gone to the doctor like to find out something else. Then that's when the doctor told me, do you know what, you have got a UTI. But also I'd started feeling the signs of...
What signs were those?
Still itchy. The
itchy part of it?
Yes.
You don't have any abnormal pain, abdominal?
No.
Nothing? No headache?
No headache.
No dizziness?
No.
No nausea?
No.
Wow.
Everything was just better. But
so you only detected it after testing?
I detected it after testing, but even before testing, since I was feeling that itchy part of it, that's when I realized that maybe I should have got a UTI somewhere. Because at least whenever I used to go to the toilet, I would be so mindful of the hygiene of the toilet, that maybe we are sharing with the other people, like with the workmates that we are with. Like you could go with jig, soap, maybe you mix them together with Omo, you pour there before using the toilet, because you don't know the person who has used the toilet before, how has that person been hygienically. And besides that, we as mothers, like our immunity of having these UTIs is very high.
Yes.
So we have to always think of our immunity first before anything else, because at the end of the day, you are going to get it, and besides that, even your partner, you are going to make your partner get the same one.
So did your partner also get it?
No, the doctor only advised that one thing, that in case you are having it, you don't treat it alone. You have to treat it the both of you.
So you went together with him.
Yes.
How was his reaction? Didn't he say this one now is, where did you get this infection from?
No, he cannot react bad, because he understands as a person, like the situation in which I am in, and being vulnerable to what I'm having within my body. So like at least God gave me someone who is understanding, who can understand that, you know, this is what my wife is going through. I have to be there for her. So because even when I was going to the hospital, he's the one who had to escort me to the hospital. Like partners, you have to always be there for each other.
True. Yeah. True. Okay. Now, how long did you treat this UTI? That was the first experience. Now, this second baby.
No, so that one wasn't the first experience.
Yes.
First experience, yes, we went together. We got the medication. Even this second one. You went together? We went together.
So the first baby didn't get an infection when you gave birth to him?
No, by the way, in fact, there is a time we reached to an extent of thinking maybe it could be this UTI that was causing the problem of this baby, because by the time we went to the hospital to give birth, I thought it was just something minor. I went to the doctor. I asked him, like, you know, there is something, like I'm not feeling that usual, but I don't know what's wrong with my baby. What I know, it's one thing. The time for me to give birth has not yet come.
How old was the baby by then?
I think the pregnancy was 7 months, coming close to 8 months.
Okay.
So like when we went to some hospital, which I won't mention, they told me you have to wait for a gynecologist since you aren't taking medication from here. So we went to some other hospital. They told me, do you know what? You just need to first make a scan and see why is the baby not feeling fine within.
Were you feeling like a pre-labor signs?
Yes, pre-labor signs. That's what I thought. So now when we went for a scan, God forbid, this doctor tells me after making the scan, do you know what? I think your kid is no longer alive. Really? I said, oh God.
Wasn't the baby breathing?
The baby was breathing. The baby was even kicking before the previous day. So now I asked him, if you are saying the baby is not alive, what have I been feeling within me? Because there is that connection between a mother and a what? And a baby. And a child. Then he was like, no. And what made me like not really take it so personal was telling me that the baby has been not breathing for the past 1 week. And I said, no, this baby has been breathing. What are you saying, that the baby is not what? Breathing. The baby hasn't been breathing for a week. Then he was like, no, maybe you are just feeling your intestines. I said, God, what I know is one thing. My baby is still alive. And I will really give birth to a what? To a live baby. Okay. Now just because of like really being that human part of it does not go away. So I was thinking, oh God, for all these months that I've carried this baby, and now they're telling me a different story. Really?
Towards the end of it all.
So now I said, then they told me the good thing, the cervix is open.
Okay.
Like we can induce the labor pains.
By then the cervix was open?
Yes.
That was dangerous. The baby was almost coming out.
They told me they can induce because now you no longer have the labor pains. So you can give birth to this baby, but what you should know, just imagine a doctor telling you this, yet you are a mother. What you should know, you are going to give birth to a child but who is not alive.
Oh dear, that was so traumatizing, Daphne.
I said, oh God, now what is this? Now imagine we are living in Entebbe. I've moved from Entebbe. I've come just to see my husband, then go back. Now you are here alone in the hospital with your husband. Your parent has not yet arrived. Oh God, now I said, this time round, it is you, between me and you, you have to just make a miracle out of this whole drama. Good enough, they induced me. I gave birth. Within just no minute, the baby was alive.
The baby started breathing.
The baby was breathing. It was only that the baby was
so
maybe tired. And so now this one, the doctor thought maybe the baby is no longer alive.
True, true.
Maybe still because of maybe the UTIs that I used to pass through, to go through within all this period of time until this, maybe it could also be one of the reasons of me like thinking that I had got a premature child. Later on, we were in hospital for like a week. They had put him on oxygen. After a week, we went back home, and these other doctors were like, no, this baby is no longer, is not even a premature. He's a grown-up baby. Because I've seen people who have given birth to real prematures, but this one is a complete baby. So we're like, okay. Now, so we are like this time round, because on this first baby still, I went for antenatal when it was really too late. So I said this time round, maybe I should be careful, also mindful. And
go for antenatal.
And go for antenatal when it is still when it is still early enough.
So after giving birth, Daphne,
yes,
did they test for UTI?
Yes.
What did the doctor tell you? What could have caused that premature birth?
Maybe they didn't just want to make me get scared so much, so they had not to explain to me all this because of the trauma I went through. So now what they did was only one after giving birth, like I was supposed to go for medication for almost 2 weeks. So I could receive injections like on a daily basis for almost like 2 weeks.
That is after giving birth.
Yes.
And what were they treating?
I think it was UTIs.
And they did not tell you?
She, by the way, the nurse like kind of told me that, you know, like you had a lot of UTI, and since you have given birth, and now your body at least it can uphold this medication, because we couldn't give you that strong medication
when you were still expecting.
When you are still expecting, because we wouldn't know, maybe we would have damaged the baby and whatsoever. So we had to first wait for you to give birth, then afterwards we had to give you what? A full dosage of that medicine.
That treatment.
That treatment of when you are at least what? When you are alone and you can sustain all this medicine within your body.
Did the baby have any problem?
No.
Did the baby cry immediately after popping out?
The baby failed to cry because maybe of being tired. So they had to first, you know, like the way the doctors have to first make this baby cry. So now after that, the baby had to go for oxygen for almost a week.
Really?
Yes.
How long were you in labor? How many hours? After induction, after the induction?
I think there were almost like 4 hours.
Was the labor constant? Was the pain constant, or it could cease a little bit?
No, the pain wasn't constant. It could come, then cease away, even forget about it, that you are in labor. Then like that, it comes and goes, until when the last time, the one really that God made that you have to give birth,
And you were
when
able
it
to
came,
push the baby.
then I was able to push the baby.
That was a very, very challenging experience. We are looking at UTI infection in pregnancy. It's a journey to motherhood. And in case you've just joined us, please feel free to listen, learn, and give us your opinion and any other comment that you would want us to air out to all the viewers when the time comes. Daphne,
Yes.
before we end that our discussion, how about this second pregnancy? Have you got any challenge again with the UTI?
This second pregnancy, I've got a little challenge with the UTI because, like, at least I was mindful from the first experience that I'd got as a mother. So now I've not faced so many challenges, at least with UTI.
How are you managing it? Because you still go to work, right?
Yes, I still go to work.
Okay.
Like, I have to move out with my jig, maybe mixed with Omo. So as I go to the urinal places, I have to first pour in that,
Clean the surface.
clean the surface before using the area.
Is that always a seat toilet or a squat?
No, it's a squat toilet.
Squats, I think, are better than the seat ones.
Yes, they are better because here at least your chances of getting the UTIs, they are not that high like those ones that you sit on, because now this one has sat on it and now you are also coming to sit on it. You don't know.
And the urine surface is so close to the body.
Yeah, so now there the challenges are kind of what? Are kind of very, the chances of you getting the UTI are very high.
Okay.
Yeah.
Okay, thank you. And I wanted to ask something small about that small trick. Who could have given it to you? Was it a medical health worker, a friend, or?
It was a friend.
Okay.
Like a friend who had given birth before. So she told me, you know what, in case you are pregnant, you have to be mindful. But still, even though you go with the jig and Omo, but also you should also be mindful of the areas, of these public areas that we use.
Especially public toilets.
Yes, because now you cannot go to washroom maybe somewhere and you see really the places, because there are places that you can really see that even though you pour there jig and Omo, still there is no difference. You are going to go out with the what? With the UTI. So you have to also be mindful of the places that maybe, yes, I am really bad off as a mother, but now am I really able to use this place? Is it really going to be helpful to me, or I'm just going to incur more problems to myself? So that also has to come into our minds, because this is our health, and being a mother, you go through a lot, because it isn't always very easy. Especially the first and second trimesters. Yes. There are a lot of challenges that you face as a mother. That is true. But now, still, like you as partners, you have to communicate. Because you having a UTI, take for example, when you are alone, knowing that I have the UTI, and maybe secretively you go take the treatment, the medication without letting the other partner of you still, meaning the UTI, you are going to carry it. You are thinking you are treating yourself, but the other person is not treated. So meaning you are going to get the same challenge from the other person that you are having what? You are sharing the bed with, because the other one is not treated, and for you are treating yourself. Okay. So meaning if you are treating yourself and the other person is not being treated, you are going to face so many challenges. So at home, how do you manage the hygiene? In case you have maids, you have relatives. At home, like good enough. Now maybe that is the only good chance I have. Like I have an inside toilet and an outside toilet. So now what I do, it is the inside toilet, it's supposed to be used by maybe me and my husband, and then the outside toilet, that is what they can use the other people whom we are with at home. Because now this one I can clean it myself. I know how to disinfect everything, and I know that maybe I have left it closed. The person also that I'm sharing it with also is conscious about my health, apart from other than like sharing it with these other people who are always who are always at home. Because now you can go away and you go for work, you leave these people home, you don't know what takes place when you are not when you are not there. So now, instead of having quarrels and wrangles with the people, then they say, hey, this lady, she has a lot of kajanja and what?
She's showing up.
So being mindful of my health, I just leave when I've closed my washroom, and I leave the other washroom for them. Okay. But still, you have to tell them to also be mindful of it, because like they will still have to also have those diseases, and at the end of the day, it will have to cost you a lot to treat them.
Okay. So what treatment were you using in the hospital? Were you giving injections, tablets?
For the first one, I got both. In fact, I got like 3. For the first one, I got injections, I got tablets, I even got like these cleansers that they use to clean after, maybe when you go to the bathroom after doing whatever you do.
Those genital washes?
Yes. Okay. You have to wash yourself with those cleansers within. But for this second one, when I went to the doctor told me it's good enough. The UTI had just begun, so he gave me medication, just gave me only tablets. I took them, and then later on became better.
Thank you so much for your experience and sharing with us, with all the mothers who are watching us. There's a mother watching you there, and she's like, oh, I'm going through whatever that she did and what she went through. What message can you tell her to encourage her, just in case she has UTI? Oh, if she does not have but expecting, how best can they avoid it?
Well, the advice I can give a mother who's going through this same experience is, in case you have not yet got the UTI, you should be mindful so much of your health. At least try your level best to be mindful of the places that you go to. Like, at least carry something to clean up the surface before using it, because you don't know the previous person who has used that place. Has that person gotten a UTI? Is that person is the person normal? Like, doesn't the person have the UTI? And besides that, in case you find out that you have the UTI, go for medication, but still go with your partner. Both of you should get medication, because at the end of the day, you treat yourself and the other person is not treated, still will get that effect afterwards.
Thank you. Thank you so much for joining us and still staying with us at Bethany TV. It's a journey to motherhood. I'm Teacher Zita, together with our guest Daphne, telling us her experience as a mother as far as handling UTI is concerned. We shall be having a short break, and we'll return with the doctor to give us all the answers that we need to know about UTI. Stay with us.
Bethany TV for health. Big and better. Kuya TV. Boringo extra. Kuya TV. Muziki and comedy. Kuya TV. Jibanda Express. Kuya TV. Kuya TV kusimio. Kuya TV kusimio. Kuya TV kusimio. Kuya TV. Download the UTV app and enjoy a big world of entertainment on your phone. Bolingo Extra for comedy and local music. Chivanda Express for movies and series. Mutuo for kids edutainment. And Your TV channels for live TV and radio. Your TV. Our people, our stories.
Health Minutes on Bethany TV.
The postpartum period is the time after having a baby.
There's a period that follows childbirth, basically. Medically, we put it around the first 6 weeks.
Some women get the baby blues or feel sad, worried, and tired within a few days of giving birth. Here are a few tips to help you navigate the postpartum period. Drink enough water.
You'll be surprised what good hydration, or at least 2 or 3 liters of fluid, can do for you in a day in terms of improving how you feel within your body and improving your mood.
Sun exposure in the morning hours.
We always recommend that mothers go out and walk and experience good sunshine. One is it helps in vitamin D, which is a very important component of breast milk for your baby, but also sunshine will elevate your mood.
Have a social support system.
It is difficult enough to have a baby. It is even more difficult when you do it by yourself. So we advise mothers to surround themselves with loving people, helpful people, who will help them both in looking after their babies and also looking after them as they look after their babies.
Better healthcare for a better tomorrow. That was the Health Minute.
bulijjo enkulaakulana etandikira mu njuuyo n'efuluma n'ogirabira ne mu bikwetoolodde n'omwana gwe omusingi omulungi ogw'okusoma oba omuwadde future entangaavu abazadde muwonye ekipya kiikino ezanta mu tawuni mu maaso g'eggombolola nga yendejje Excel Junior School lisomesa abaana okuva ku nasale paka mu primary 7 somero ddungi ate nga linyirira abaana balya bulungi balanced diet lirina abasomesa abalungi ate nga bakugu twala omwana mu ndejje Excel Junior School afune future okumanya ebisingawo essimu not musanvu not 3 kyenda mu 5 kinana mu 7 not ndejje Excel Junior School achieving excellence together.
Bethany TV for health.
Welcome back from that break. It's still Bethany TV and I'm Teacher Zita. We're talking about UTI, a bacterial infection during pregnancy. And right on the set right now we have a doctor who is going to give us all the answers that we've been looking for. Hello, doctor.
Hello.
And welcome to the show. I'm so excited to see you.
Thank you.
Please say hello to the viewers.
Good evening, viewers. My name is Dr. Charity Oneko and I work with Bethany Women and Family Hospital in Entebbe.
Thank you so much. We are privileged to host you.
Yeah.
Doctor, we're looking at UTI. What is UTI? We used not to have such things back in the days.
Oh.
Yes. What is it all about? UTI. Everywhere UTI. Infections. What is it all about?
UTI is an abbreviation for urinary tract infections. And if I must say, the urinary tract is, the system in the body that is responsible for filtering, storage and excretion of urine.
Okay.
The body makes toxins from the food we eat, from the medicines we take, and just from normal processes of growth. So the waste products have to get out of the body. They are filtered in the kidneys, they go through the ureters, and the urine is temporarily stored in the bladder, so you don't have to go every 2 minutes.
Yes.
And then eventually it passes out to you excrete it through the urethra.
Okay.
Yeah, now the urinary system is very close to another system, which is the reproductive system.
Oh.
So sometimes
that is in women?
Yes, in women. So sometimes we lump them together and call it the genital urinary system.
Okay.
Now the two are very close and they interact, but they do different things.
Okay. Okay. Yes. Thank you so much, doctor. Why is UTI so common in pregnant women?
Well,
especially as soon as you conceive, you'll never walk out of a hospital.
Yeah.
Yes.
Pregnancy is a journey.
Okay.
And there are a lot of changes that happen during pregnancy. And the changes are good things that help the body to adapt.
Okay.
And function better with this additional there's a whole human being growing inside of you, so the body has to make some adjustments.
Okay.
Now these adjustments sometimes increase the risk of women acquiring urinary tract infections.
Okay.
Yeah. For example, some of the changes that happen, the pregnancy hormones, progesterone, cause the system to relax. So the ureters are relaxed and get kind of lazy.
To protect themselves from...
Yes, they don't work like they work every day, so they are lazy.
Routine.
Yes, now in their being relaxed, there are points of the ureter that are more prone to compression. So the pelvic pressure in the abdomen is increasing because the baby is growing. So there are parts of the ureters that can be compressed a bit. So if we don't do the right things, there's compression, and then this compression plus the relaxation will cause stasis of urine. So the urine may not flow out as it should. And I usually tell my mothers that when urine stagnates in the system, like stagnant water, it rots more easily. So normally, there's something we call asymptomatic bacteria. Like 1 in 10 women have it. Now, when a woman gets pregnant, the chances of the asymptomatic bacteria giving her a urinary tract infection, making her actually sick, increase like 4 times. So 40% or 4 of 10 women will have the asymptomatic bacteria that normally should not make them sick, making them sick because of the changes that have happened in the urinary system.
Thank you so much, Doctor. It used not to be so common in back in the days.
Yeah.
Because when you tell our grandies that have UTI, they'll ask you what is UTI. But of late it's so common. Could there be some physical forces or medical, I don't know, changes in the environment that could be really triggering these infections, infections?
Well, besides the normal changes in the body that make a woman more prone to infection, I personally think that sometimes we mix 2 things. Well, there's a urinary tract infection and then there are vaginal infections.
Are they different?
Yes, they are.
Can you explain something brief about that?
Yes. Now, the vagina is a different system. Vagina, cervix, uterus. It's different from the urinary system, but they are very close. And sometimes when one is sick,
they work together.
Yes, when one is sick, the other is also sick. But sometimes it's just the vagina that is sick, and people just blanket it as UTI. Have you heard about acute vaginitis? Have you heard about vaginal candidiasis?
Yeah, candida.
Have you heard about trichomoniasis?
No.
So people mix. So everyone,
I think it's come from the medical workers.
Yes.
You were going to tell us it is UTI, and then since
maybe
we don't know.
It's simpler to tell people you have a UTI.
Sure.
Yeah, so every time they go to the hospital with vaginal symptoms or urinary tract symptoms, I think that they are blanketed as UTIs. So we should know the difference. We should ask the doctor. Mothers should be very, very vigilant when you go for this test. Ask a medical worker what kind of infection is it? What infection? Is it around the vaginal walls, inside the urinary tract area? So we should really, really be specific. What they say this mother has kajanja. No, actually it's the work of the doctor to guide and get the accurate symptoms from the mother. The mothers don't know.
Yeah, surely we don't know.
They don't know. So they will just tell you, doctor, I am itching, I have a white spoiled milk-like discharge. So it's the responsibility of the doctor to evaluate and see, is she talking about urinary systems? Is she talking about vaginal symptoms? Or is there both? They can both happen.
They can be there.
Yes, the typical urinary tract infection symptoms for a pregnant woman. Pregnancy, is different, changes things. So for a pregnant woman, they may have low abdominal pain, they will have frequent urination, they go to toilet every 5 minutes.
So when you urinate frequently, it means you are having some infections or something?
Sometimes, yes. Passing urine every 5 minutes, every 2 to 3 minutes. And then when you go, you want to come back, but you feel like, I've not emptied the bladder completely. I still want to go back.
So now, are those the signs that mothers should look out for?
Those are the symptoms of a urinary tract infection. However, in pregnancy, it may be a little bit different.
Okay.
They may have symptoms of the first trimester coming back.
Okay.
Doctor, I feel nauseous. I've been okay. This trimester I thought I'd improved. Now I feel nauseous again. I feel weak.
And by the way, doctor, when you have UTI, you feel like throwing up. You feel like that
for a pregnant woman.
Yes, for a pregnant woman. Yes. So when you have the UTI, also you feel the same. You get the same feeling. So sometimes you think it's nausea, yet it is UTI.
Yes, it's UTI bringing back symptoms of the first trimester.
So you relax thinking it's
so they
the
get
same.
low back pain, and sometimes they get uterine contractions, like labor-like pains. Yeah. And that complicates the whole.
Thank you so much, doctor. Which area is always mostly affected when you have that UTI?
A UTI in pregnancy. Yeah, UTI in pregnancy will complicate the pregnancy. Apart from making the mother sick, and she fails to eat, and you know she's feeding two people. So if she's not eating or if she's vomiting, sometimes the UTI itself will cause contractions that will push her to preterm labor. You know, labor should come after 38 weeks. Now, if it comes earlier than that, it is preterm, and we don't want prematures. Yeah.
Thank you so much. We're going to talk about that owing to the experience of the mother that we've been just having here. What could be causing these UTI infections in pregnant women? Because if you're not pregnant, you're always okay, but owing to explanation, the body, some parts relax, some blah, blah, blah. Then what could be the real cause that mothers should really avoid?
Well, let me call them risk factors and not causes. Apart from that, pregnancy, the changes in the body that happen during pregnancy, sometimes our posturing, the positions we take, like we encourage the mothers to lie more on the left lateral position because it improves venous return, so blood flows better, and then they can pee a lot, like better. And we want mothers to drink a lot. So sometimes mothers, when they're not drinking, they'll get dehydrated. The little urine in the system doesn't want to come out, so they get stasis of urine, and stasis will allow organisms to multiply.
What is that stasis thing?
Stasis is like stagnation. Yeah, so
something
we encourage them to drink so that they pass urine frequently, and that is a natural way of cleaning the system. That flushing effect of passing out urine. Yeah, it's a God-made way of cleaning out the urinary system.
I hosted a mother, Daphne, and she was telling us her experience that she had severe UTI, and before the time was, I think, towards 8th month, something that I have not forgotten, she developed that serious labor, pre-labor pains, and I think when she went to the hospital, the doctor told her, you know what, your baby is no longer breathing, we need to induce you. She got so scared, she was so worried, but she had hope, she had her faith, and eventually she was induced and the baby came out, but so tired, and immediate after that, I think she was put on strong medications to help her get better. Could that have been the effects of UTI causing the baby to come out quickly?
Well, a urinary tract infection will stimulate, there are factors in the body that cause the uterus to contract and push the baby out. Now, those factors are not activated until it is time. The factors about the baby and about the mother that are activated when it is time for the baby to come out. Now, if there is a urinary tract infection, it will kind of mess up that factor. So sometimes the infection, sometimes a vaginal infection can ascend to the uterus and cause choriamnitis and also cause preterm labor. Sometimes the urinary tract infection itself makes the mother sick, gives her fevers, and induces those chemicals in the body that will cause the uterus to start to contract when it's not yet time for it to contract.
Thank you so much for the explanation. We are going to take your calls. Our numbers are on in case you want to be part of this show. You can call in, you can send in your messages on WhatsApp, and we shall be able to read them out on 0786050762. We have also another line that is 0742808892, and you'll be part of a Journey to Motherhood discussion. Tell us your experience as far as UTI infection is concerned. Doctor, does UTI have any side effect on the babies, or like maybe birth defects if the baby's out, or something like that?
Maybe not birth defects, because birth defects are a function of formation.
Okay.
When the baby is formed nicely, we thank God it's formed. Now the UTI most times will cause, if it causes preterm labor, when baby comes out before their time, then they are prone to developing difficulties in life. If they come out very early, they may not be able to hear well, they may not have developed their sight well, sometimes their brain. Yes, if we do not protect them so well at birth, then they get damages in their brain, but not really birth defects. Now the best thing is to keep the babies inside until they are term, like the God-defined clock for baby to come out. That is when it is safest for them to come out. So anything that causes baby to come out earlier,
before its time,
is not nice.
Thank you.
And we have to fight it and prevent it.
Okay.
In any way
Yes,
we can.
one of the listeners is saying, does it cause death? Can a baby lose its life while still in the womb?
Yes, because those contractions, they actually get the babies tired. They get the babies tired from inside. Now, if they are not strong enough to push the baby out, baby can get exhausted from inside.
Dear.
And if there is choriamnitis, if it's the infection spreads to the membranes around the baby, then baby gets sick, baby can die.
Okay, oh dear.
Yeah.
When the baby is still inside.
Yeah.
Thank you so much. What can be the treatment options for the UTIs during pregnancy? Because mothers are so complicated. There's some medicine you people cannot use when we're expecting. So how best can you really treat that to avoid all those deaths, all those miscarriages?
Well, the best thing to do is prevention. We'll talk about prevention. But since you asked about treatment,
for example, someone now has it.
Yeah.
Yes.
If someone has it, we need to evaluate them. We need to, most times we do their vitals. How bad is it? How far has it gone? And then we check the urine. And I always encourage mothers to be careful not to contaminate urine at the time of collection. So that's when the difference comes in, like, is it a urinary tract infection or a vaginal infection?
How can urine be contaminated, yet it's going through the same passage?
So we encourage them to collect the midstream urine, which will be more representative of the urinary system.
Someone is watching you and are wondering, what is midstream?
Midstream is, you first pass out.
We have a caller. Someone wants to talk to you. Bethany TV, hello. Hello, caller. Hello. Sorry, I think we've lost we've lost her. You are still telling us the midstream.
So the midstream, we collect the middle urine. When you pee, the vagina is very close to the urethra.
Okay.
So when you've moved around the whole day and vaginal fluid is all around the urethra. So when you pee, you flush the first urine, it can collect the fluid from the vagina and all around. So that will not represent what is happening in the urinary system. So you need to give the midstream urine, the middle one, that is more representative of the urinary system and not just a collection of whatever is happening around the vagina.
Okay.
Yeah.
Oh, I've now understood the difference.
Yeah, so when you get a midstream urine and we determine that yes, there's an infection in the urinary system, then we go on to treat.
Okay.
The doctors will give you antibiotics, they'll give you painkillers, and sometimes they give medicines to stop uterine contractions if there are contractions already.
Okay,
Yes.
that is when the baby is not yet ready.
Yes.
There's a way you people can prevent the baby from not coming out before it's mature.
We buy time.
Oh, that's very good.
And then they also give medicines to mature the baby's lungs.
Okay.
If we see that this baby might actually come out and it's not ready. So we give medicines to prevent. But the best thing, the objective of treatment is to try and stop this infection, so that the labor does not progress.
Thank you so much, Doctor. I have some messages here, and she's saying, my name is Asimwe. So cheating partners are not causes of UTI. I used to have UTIs all the way till I stopped touching inside my vaginal area while bathing. Now I am free. Is that true?
Well, we do not encourage women to touch their vagina, inside the vagina, because the vagina is designed to clean itself out.
Okay, okay.
And touching it, introducing all the time, you actually pick organisms from around and introduce them in there.
Okay.
So it's not advisable for women to push their fingers in there all the time. There are times you can, which we can tell you, but normally it's not necessary.
Not to.
You just need to wash the outside, maintain perineal hygiene, wiping from front backwards, shaving, washing up frequently. Yeah, so.
Thank you so much. Asim, I think you've got the answer right from doctor. Yes, and we have someone here. She's saying, yes, good evening, doctor. I would like to know what causes much heat during pregnancy. Nabogoma, something like that, much heat.
The pregnancy hormone, HCG, the sustained pregnancy, is very, very similar to a hormone, thyroid. Thyroid stimulating hormone that is responsible for metabolism. Okay, so apart from the pregnancy itself increasing your blood flow, increasing your demand so that your metabolism is very high and blood flow is flowing very fast, even that hormone, it behaves like the thyroid hormone. So you also feel the heat. Yeah, you're just hot while the rest of us are cool.
Okay, thank you so much, doctor. This is Shami.
Yes.
I think I have vaginal itching, as you said, but when I went to the doc, they gave me amoxicillin, but it did nothing. So I need some advice because I'm dying with it.
So the vaginal itching, you see, vaginal itching is not a urinary tract infection. You get, that's why I said there are
You have a caller before we answer,
things.
Shamim. Caller, hello?
Yes, hello.
Hello, dear. Good evening.
Good evening, how are you?
I'm fine, thank you. How are you? Who is calling?
Fine, fine. Now, this is the one speaking to.
Yes, Ronnie?
Yeah. Now, I want to ask the doctor.
Yes.
My question is, you moderator, eh?
Yes, please.
Hello?
Hello, we are getting you well.
Yes, no, my question was,
Yes.
now, can you tell the doctor, all you people who are in that studio, I need to put that program in Uganda and English.
Okay.
Because there's some other people, they're interested to look at that program and to understand very well.
Okay.
You should at least balance in Uganda and English.
Thank you so much.
Okay.
Thank you. Thank you.
Very nice. Thank you. Yes.
Thank you so much for your views. The PD is listening. He will work on you. Thank you so much. Doctor, you are still telling us about?
So the itching is a vaginal problem primarily. So by giving amoxicillin is one of those drugs used to treat UTI, yes. But you may not solve the problem. You may actually make it worse. Because vaginal
Someone is calling you, doctor. Someone really needs to talk to you. Bethan TV, hello? Hello, caller.
Hello.
Hello, good evening.
Good evening.
How are you?
I'm okay. How are you?
I'm fine, thank you. Who is calling?
First of all, I want to appreciate this program
Thank you.
because it's helping a lot of people around.
Thank you, thank you.
But I have only one question.
Please go on.
My wife, she's pregnant 4 months now,
Okay?
but she's having some complications like the way doctor said, itching. Another thing, she has some abdominal pain.
Okay?
So I don't know whether she can get a solution for it.
Okay.
Yeah. So
Thank you so much for calling. Doctor is right here to get back to you.
Well, thank you for asking.
Before we respond to that, I think there's someone else calling. Caller, hello? Bethany TV, hello? I think we've lost
Good evening,
him.
madam.
Oh, good evening to you. How are you?
Doctor, I have a question.
Please go on.
Can that UTI make a baby to be born when it has a positive said as if it has no bone?
Did you get that question well?
Can UTI make a baby be born without skull bones.
Bones?
Like it's soft, like
something like that. We have another call on the line. Bethan TV, good evening. Hello, caller.
Hello.
Yes, please, good evening. Go on, we can hear you. Sorry, we've lost her. There is another caller. Caller, hello?
Hello, good evening, doctor.
Good evening to you.
Yes, I wanted to ask.
Yes, please.
Is it that whenever a lady has abdominal pain, is it a UTI? Especially in the third trimester.
Okay.
Because when ladies go to the hospital and they have abdominal pain, doctors usually say that's a UTI and they are put on antibiotics. I want to know,
okay.
Is it that any abdominal pain in pregnancy is due to a UTI?
Thank you so much for your question. Doctor will get back to you. We have another call on the line. Caller, hello? I think we've lost them. We start with the itching and the abdominal pain. I think you had answered this.
Well,
last caller. Caller, hello?
Hello.
Good evening to you, caller. Sorry, we've lost her. I think you were still talking about the babies being born with no bones.
Vaginal itching.
Did you answer that? I think we did.
Let me just complete.
Okay, you can complete this. Yes, we're distracted.
So vaginal itching, most times, not all the time, but most times is from vaginal candidiasis, the commonest cause. There are other causes. So treating it as a UTI is not really right. So that person with vaginal itching that is getting worse may benefit more from an antifungal. However, they need their doctor to evaluate and see and examine them and see the type of discharge they have, see where the itching is coming from, and then they can get the right treatment.
Thank you so much. I think our callers are listening. And then the second one.
And the baby
being born without bones?
Baby being born without bones in the head, that is a birth anomaly called anencephaly.
Oh.
The skull bones do not form.
Is it also caused by UTI?
Not necessarily.
Okay.
It may be formed by other injuries that happen very early in pregnancy when the baby is forming in the first 3 months. That is why we encourage mothers not to self-medicate and start antenatal as soon as possible, and we give them folic acid in the early pregnancy to prevent these brain and spinal cord and skull problems.
Okay.
Yeah, the folic acid is very important on this one, and I think most health workers actually do give women folic acid.
Thank you so much.
It's best when it's introduced in the first trimester.
Thank you. We have another caller, doctor. Bethan TV, hello.
Good evening.
Good evening, caller. How are you?
I'm okay. How are you?
I'm fine, thank you. Who is calling?
Hello?
Can you be louder? Can you be louder? We can hear you, but you're low. Hello. Sorry, we've lost him. You can send your question through a WhatsApp message. The numbers are right on the screen, and we shall read it out very well. Yes, we're still talking about abdominal pain. Yes.
Well, not all abdominal pain in pregnancy is UTI, especially in the third trimester.
In the third trimester.
The commonest cause of pain and cramping is UTI. That is why at most antenatal visits, we'll request a urinary tract, a urine analysis to be sure that the urine system is clean, because it causes contractions. So if there are other causes of abdominal pain, and your doctor can identify them when they evaluate, there can be very term pregnancies. You can have false labor.
Okay.
Like uterus
especially the third
practicing,
trimester.
Practicing for delivery. So you have false labor.
Okay.
Then we can have other factors like pregnancy with fibroids on it.
Sorry.
Also cause pains.
Okay. Caller, hello.
Yes, hello.
Yes. Good evening.
Good evening, madam.
Who is calling?
This is Joy.
Yes, Joy. Where are you calling from?
Yes, I'm calling from Kono.
Please go on.
Now, we took a scan, sonographer took her scan my head. The finding was it was a sound, ultrasound scan that a thick abdominal mass noticed.
A cystic abdominal mass.
So we wanted to find out if she be able to get pregnant because she's telling me she's just having abdominal pain.
Thank you, Joy, for your call. Did you understand the question well?
Yes.
Thank you.
Yes, the lady was found to have a cystic mass in the pelvis.
Okay.
And he's wondering if she would be able to get pregnant.
Okay, to conceive.
Yes,
okay.
Sometimes there are cystic masses that arise from the ovaries. And usually if they are less than 5 by 5, we don't touch them. Like, there's no point in, operating you to pick it out. If it's more than 5 by 5, then we can consider removing it. Sometimes the masses are incidental findings, but sometimes they cause pain that sends the mother for the scan. Then we see that, oh, there's a cystic mass there. Okay. But I must say that most women in reproductive age have functional cysts in the ovaries. This is normal. Every time we ovulate, we leave a cyst behind to preserve that egg until it is fertilized and it implants.
Okay.
So when you see a cyst 2 by 2 centimeters, it measures 1.7 by 2 by 2 centimeters, that is normal.
It is normal.
That shows that you're ovulating.
Okay.
Yeah.
Thank you so much, Doctor. You really have a lot of questions here, but I'm glad that you're trying to get back to the viewer and he or she is listening to you very well. We have a question here. Hello, doctor. I am an expectant mother. I have this challenge of constipation, of which I take 3 days without passing out sometimes. I feel a lot of gas in the stomach. I'm wondering, is it normal? Yes. This is not concerning the topic, but still, nevertheless, please, you can answer the
constipation. Mother. Constipation is one of those what we call minor disorders of pregnancy because of the relaxation we talked about. The hormone will not just relax the urinary system, it will relax the rectum, but also there is pressure from the baby's head, the uterus growing all big from down in the pelvis. True. So there's a lot of pressure on the pelvis, and sometimes that causes delayed emptying. And once the bowel emptying is delayed, the body keeps absorbing the water from it, and then the stool becomes hard and difficult to pass out. Now, the home remedies for constipation, we encourage mothers to eat, high fiber diet. Like, you can eat cabbages. You can do pawpaw.
Ripe pawpaws?
Yeah, ripe pawpaw is good for constipation.
How about warm water?
Warm water is okay, but remember the question on heat.
Oh.
Some mothers don't want so much warm water, it makes them nauseous.
Okay.
But even cold water is okay for the heat.
Okay.
Yeah. Just eating, eating high fiber foods.
Like
eat your fruits whole, instead of blending it and sieving it 3 times. So eat the fruit whole, so that the fiber, the hard part of it,
can help
will go down to soften the stool.
Thank you so much, Doctor. We have a lot of questions here that we've not answered, but I think we shall answer them in the next program. In case you've missed out on this show, please, there is a repeat always, that is I think on Monday, Tuesday, it's always Tuesday. Please listen it at 2 p.m. You can listen and learn, and even on YouTube, you can follow us, Bethan TV Uganda, on YouTube, and you send your questions. The doctors will definitely get back to you. You can as well WhatsApp us, join a Journey to Motherhood WhatsApp. You ask many questions, and we come and discuss them out here. We are almost signing out, but we assure you as Bethan team that the doctor next week will be able to answer some of these questions that have not been attended to. Doctor, please, we are signing out. Encourage a mother out there.
Yeah.
Yes, and especially those who are expecting, how to avoid UTI, and those who have, how best they can prevent it from recurring.
Dear mothers, pregnancy is a journey that I believe should be enjoyed. True. It is not a punishment.
True.
And most important is if we stay healthy. There are very simple practical ways of staying healthy. We drink plenty of water so that the urine system is flushed all the time. We maintain perineal hygiene by, wiping front backwards, cleaning up after toilet.
That is after using the toilet.
Yeah.
Mothers should not wipe anyhow.
No, wipe
front
backwards, yes. And bathing and changing panties frequently, shaving up, and also our posturing, lying on the left lateral position will improve drainage of blood and then emptying of the urinary bladder. So that will help us stay healthier. And if we have symptoms, it's very, very important to see the health worker and have them assess early. We don't wait for it to escalate to the point of babies coming out.
I know.
Yeah, so we assess early and initiate treatment so that we prevent the complications of UTI.
Thank you so much, Doctor, for those wonderful teaching. I've learned a lot, and I'm sure the mothers are outside there because still had a lot of questions, but though we couldn't answer them. It has been very nice hosting Doctor and you being part of the journey to motherhood. We've been looking at UTI. The most common fact that you should know about UTI is that treat it. Don't dodge around, avoid self-medication because it will never go away. And in the end, it will bring you a lot of problems with your doctor. I'm Teacher Zita. We are signing out tomorrow. Don't miss out on Medical Minds. We have a lot to tell you. From the team, good night.